My name is Anthony Villare. I'm an orthopedic surgeon here, new orthopedic surgeon here at Upland Hills. Excited and proud to be here. I have two kids, Daniel and Sarah, who are currently in college at University of Wisconsin in Madison. So, and I couldn't be prouder of them. And you know, my wife Beth, she's still with me, and we're just kind of making our way around Wisconsin. I like to bake, I like to cook. I'm a foodie guy, I like to go out and eat. So if I'm not making food at home, I'm going out to a restaurant somewhere. I come from a family of doctors. My father is a family doctor still at 80 years old. He's a family doctor, and he still does house calls, and he still rounds on patients. And for his older patients that can't make it in, he grabs that little black bag we're all familiar with. He has one of those. And he's a family doctor. His brother is a vascular and cardiothoracic surgeon, board certified. So yeah, that was a lot to meet up to. What was their father? You know, my grandfather, he was a pipe fitter in the Union, ex-Navy guy. So I kind of joke with patients that they say, well, why do you like orthopedics? What made you go into that? I said, well, because I kind of understood that. You know, because I worked with my grandfather building and renovating houses for 5 years when I was a young teenager. So drills and screws and plates and all, I kind of understand that. You know, it's up here. I'm all about information. Knowledge is power. I'll go over the x-rays with them, and I'll give them the options of treatment. I'll lay out everything in front of them, and I'll say, here are your choices. But a decision of surgery, that has to be made by the patient. I think that's what helps make the whole joint replacement experience a more successful one, is if a patient is totally involved in that. I mean, involved more than just being there for the surgery. You know, they have to be there for the rehab. That's critical. They have to have the right mindset that I'm gonna get through this because this is something I decided. Failure is not an option. There's two parts that's most rewarding. Number one is you're able to return a patient who in the beginning of their journey with me was either in a wheelchair or on crutches, you know, or something, or in the ER, you know, with an injury. You know, it's not just all about joint replacements. It's about fractures and it's trauma. It's about injuries at work, you know, and all that. So taking a patient from that beginning and then seeing them at the end where everything's healed up, they have regained full motion and function, and it's pain-free, whatever joint they have, and for the patient, I'm sure that's great, obviously. For a surgeon, I mean, that's the goal. The other thing, which is sort of I guess it's a selfish thing, as orthopedists, we're not patient. We don't have the patience that a GI doc has, or a cardiologist has, or an endocrinologist has. We need to see results now. and we do it, we get in there in surgery, we do our hour or two of surgery, we fix what needs to be fixed, like carpenters, we're the carpenters of the body, the mechanics, and then we get to look at a picture and it's fixed. Everything's back where it should be, and it looks good. And everything looks textbook. And that would be the other satisfaction. But that's a personal satisfaction. You know, the other is I like to just see a patient do well, you know, but it all starts with having, you know, your legs straight. So,